One of the things that we really look to understand whether a child has NVLD or not is that verbal, nonverbal IQ split. So, which is not necessarily typical of children with other disorders. You wouldn't expect, for example, to see that with a child with attention deficit hyperactivity disorder.
So at schools, kids with nonverbal LD tend to stand out. The unevenness of their abilities and the unevenness of their performance is something that's pretty noticeable in a school setting. What strikes teachers, I think, most about kids with NVLD is the social difficulties that they have.
And NVLD, which is shared with autism spectrum disorders, that there can be difficulties understanding nonverbal cues, there can be trouble with reciprocal conversation, with understanding that you're talking with somebody and not talking at them. There can be difficulties with peer interactions. Like, those are some of the social difficulties that are shared.
Their visual spatial deficits make it hard for them to remember and access the procedure for how to add fractions when the fractions are presented to them vertically, but when the math problem is written horizontally on the page, they recognize it. We at Columbia are working on understanding the neurobiological underpinnings of NVLD. That will help us develop treatment and also demonstrate that it's a valid clinical entity that requires recognition in the official system.
We can test the idea that nonverbal learning disability children often have very good joint attention, but they have anxious attachment or insecure attachment.
And I think one of our hopes with this research study, if we can determine some of the underlying or early predictor behaviors that mothers and infants display together that later are associated with these nonverbal learning disabilities, possibly we can design interventions for mothers with their infants early on.
NVLD has been around for a long time, and that there are a lot of kids who have these problems, and you see them in schools. It has never been recognized officially as a diagnosis that you could write down, get reimbursed for, or use. Therefore, often people don't recognize it, that they know that these kids have problems, but there's no diagnosis for them. There's not a home.
I was inspired to start the NVLD project because my daughter was diagnosed with NVLD when she was 5, and there was not the right school for her, and she never really felt part of a community. And I felt it was a real opportunity to give others the chance that she didn't have.
So here at Columbia University in the Child Psychiatry Division, we're very excited about partnering with the NVLD Project in order to help with this awareness, help to bring information to families, educators, and other mental health professionals so we're best equipped to help children that are struggling with the various challenges when you have this disability.
When you donate to the NVLD Project, you will be supporting groundbreaking research and school-based workshops, and this can lead to changing children's lives and improving their lives. And changing one life is amazing. The ability to change hundreds and millions of lives potentially would be amazing. So please donate.